Hello, I am Dr. Khaled Imam. I'm the Director of Geriatrics at Beaumont Hospital, Royal Oak, Michigan. Today's topic is about understanding dementia. As you are, majority of your audience aware that dementia is an illness that affects the elderly patients. And unfortunately, as our population is getting older, we are going to have more patients with dementia, especially in the next 25 to 30 years as a baby boomer is reaching the retirement age. Dementia is a term describe a condition which is the acquired syndrome of decline in memory and other cognitive function. Basically, it starts with a short-term memory impairment and then other aspects of the brain function such as thinking, judgment, orientation, and personality tends to change as the disease is progressing. It's not a normal part of aging. We still see people in their 90s and 100 years of age who do not have dementia. If you look at the brain is the one in control of cognitive function, orientation. Actually, this is the main center in the body, as everybody knows. The brain has different lobes or different sections. The frontal lobe, which is in the anterior aspect or the frontal aspect of the brain, then parietal lobe, occipital lobe, which is in the back of the brain, temporal lobe, and then there is the cerebellum, which is in the lower part of the brain. Now, the brain consists of billions of brain cells. They are called neurons. And those neurons are connected with each other with something called axon and dendrites. The axon and dendrites, they connect with each other, and this is the way the brain communicate between various sites. And this is the way that the brain cells relate any information from one area to another area. Now, in people with dementia, specifically patients with Alzheimer's disease, that communication get disconnected, or the function of the brain cells also get affected. For example, the brain cells metabolism becomes affected in people with Alzheimer's disease. Their ability to communicate and connect with each of the neurons also get impaired. And the ability to repair any damage becomes much more diminished as people get Alzheimer's disease, and especially when the Alzheimer's disease is getting more advanced. Now, the early signs of Alzheimer's disease start with short-term memory. Reason for that is there's a small area of the brain called the temporal lobe, and specifically the hippocampal area. This is where the changes starts in people with Alzheimer's disease. And that area is responsible for short-term memory. This is why the early signs of dementia, specifically Alzheimer's disease, is short-term memory impairment. And some of the changes could be seen in the brain even 10, 15 years before we start seeing any clinical signs. We call it preclinical stage. And there's a lot of research that is going on now trying to identify people who are still in the preclinical stage. So if there is any new interventions or there is any new treatment to halt the progression of the illness will be started and at early stage, and hopefully will be more effective than trying to treat the disease once it's well established. Now, the disease does not limit itself to temporal lobe or to the hippocampus. It starts spreading to the rest of the temporal lobe and also start getting into the frontal lobe. Frontal lobe, this is where the personality is. This is where the judgment, executive function, which means his ability to think about something that you want to do and then think about the steps to achieve what you're trying to do and then do it. And as the disease is progressing, more symptoms start appearing. For example, confusion, wandering, having word-finding difficulties, having abnormal behavior, having unacceptable behavior sometimes in social gathering. As the disease progressing, more areas of the brain becomes more involved. For example, the occipital lobe, which is the posterior aspect of the brain that is responsible for the vision, Parietal lobe that is responsible for our identity in space. We call it spatial orientation. Also get more affected and involved in the as the disease is advancing. Now, patients with advanced stages of dementia, including Alzheimer's type dementia, they start having trouble in recognizing their family members. They start trouble having their daily chores. For example, they might become incontinent, they might stop eating, they start losing weight, and the death, unfortunately, is you cannot prevent it. And the reason people with dementia die are usually those with infections like aspiration pneumonia, urine infections, and sometimes accident like falling and sustaining hip fracture or brain bleed. Now, we spoke about that a little bit before. Each area of the brain has a specific function. And with the newer technology like PET scan, positron emission tomography, that we give a certain chemical that is taken up by the brain cells, and from the concentration of that chemical, we are able to determine the function of various brain cells. An example, the frontal lobe is responsible for personality, restraint, judgment, executive function, planning, and so forth. Temporal lobe is responsible mainly for memory and to some extent for language comprehension, especially if people are right-handed. The left side of the brain will be the dominant one. Parietal lobe is responsible for spatial processing and orientation. Occipital lobe has the vision center. So visual processing and orientation are located in the occipital lobe. Now, if we do a PET scan on a normal person, and we have the person hearing a specific word. The word could be apple. We see that a special area of the brain lights up because this is the area that is responsible for hearing that specific word. If the same person is speaking that word, different area of the brain will become active. If a patient is reading the word apple, third area of the brain will become active. If a patient is thinking about that word, a different area of the brain becomes more active. This is really important because symptoms of dementia and symptoms of other neurological illnesses will be dependent on the area of the brain that is involved with the pathological process of the dementia. When people having dementia, certain areas of the brain are affected where the brain cells are dying or their function becomes abnormal. Okay? And that manifests with various symptoms such as memory impairment, such as difficulty ambulating, such as poor judgment, and so forth. So when we try to classify dementia, Alzheimer's disease is the main type of dementia, responsible probably for about 60% of dementia cases. However, there are other types of dementia, like Lewy body dementia, frontal temporal dementia, vascular dementia that we see in people who have had multiple strokes. There are other dementias because of infection in the brain, like encephalitis or Jacobs-Creutzfeldt disease. They will be dementia because of repeated head injury. You see that in athletes as they are getting older. So there are several types of dementia. Dementia is the term that we use to describe the overall memory impairment and impairment in other domains of cognitive function. So Alzheimer's disease is still the #1 cause of dementia. So based on the area of the brain that is involved, various types of dementias are being distinguished based on the symptoms that is a reflection of the area of the brain that is involved. Dementia could be classified into primary dementias, like because of a neurodegenerative disease that affecting the brain, there is abnormal metabolism. We still don't know why certain people develop Alzheimer's disease and other people might develop Lewy body dementia, frontal temporal dementia. There is some genetic link to certain types of dementia, but in others there is no specific gene that could be identified. And it depends on the type of dementia. There are different precipitation of abnormal proteins in the brain. In the case of Alzheimer's disease, this is the beta amyloid protein. For example, in Lewy body dementia, this is the Lewy body deposition of a alpha-synuclein protein. So each one has a different types of protein that clumps and precipitates in the brain cells that will lead to the destruction of brain cells and or abnormal function of other areas of the brain. There are different types of dementia. We call it secondary dementia, that people are not born with the predisposition to those dementias, but they are because of something happens to the brain, such as infection, injury, tumor, and so forth. Okay? We really concerned about dementia because this is an illness of the future. What I mean by that is we have about 6 million Americans with dementia in 2013. By 2050, we're going to have at least 14.3 million Americans with dementia. And this is really becoming more common. If we look at people above the age of 85, probably half of them will end up having some type of dementia, specifically Alzheimer's dementia. And life expectancy after the diagnosis of dementia is between 8 to 10 years. So our chance of being dementia-free start declining as we are getting older. Probably you could see that from this graph. So people at the age of 100, probably 85% of them, 80 to 85% of them do have some types of dementia. Only 15 to 20% are dementia-free. And that illustrates the huge number of patients with dementia that we are going to have in the next 30 to 35 years. Okay? Dementia is different from other types of illnesses. If somebody has a heart disease, that heart disease will affect that patient. If patient has diabetes, it will affect the patient. If patient has an infection. However, in patient with dementia, the impact is not only on the patient, but also on the family and society. It's estimated that $230 billion are spent annually on the care and or loss of productivity of patients with dementia. And still Medicare, Medicaid, and private insurance, they pay a certain amount. Majority of that is really on the shoulders of patients and their families. And even if people with dementia are having other illnesses, the cost of taking care of that illness is more in demented patients compared to those who are not demented. Example, heart disease, diabetes, lung conditions, kidney conditions, and so forth. Reason for that is patients with dementia usually are not compliant in taking their medications. They are not compliant in following up with their physicians and keeping up with the healthcare advice and instructions that is given by their primary care physicians. As I mentioned earlier, Alzheimer's disease also, or dementia in general, affects the whole family. Caregivers, and usually they are the family members, spouse, daughter, son, daughter-in-law, son-in-law, grandchildren. They spend between 40 to 100 hours a week taking care of a patient with dementia. 90% of the caregivers are affected emotionally. They become depressed, they are frustrated because of the caregiving of somebody with Alzheimer's disease. 75% reported being depressed, and 66% have significant depression. And half of them really stop paying attention to themselves because they are very involved in providing care to somebody with Alzheimer's disease. There is a book called The 36-Hour Day. This is a diary of somebody with a family member of Alzheimer's disease, just describing that in order to take care of the patient and go on with the daily routine, you need more than 24 hours in a day. Okay? Now, it's really important to distinguish between normal forgetfulness as we get older and forgetfulness that is associated with dementia. All of us, as we are getting older, we tend to become forgetful, and this is normal part of aging. However, if this is normal part of aging, usually you forget names, phone numbers, appointments, but usually the forgotten data are remembered at a later time. And usually this is trivial, this is not something that is very important. So you might forget a name. However, patients with dementia, they might not recognize a family member. They might forget to serve a meal that they just finished preparing. They might substitute inappropriate words in their speech. They might getting lost in their own neighborhood. They might put an iron in freezer, for example, instead of putting it in its own place. They also have huge mood swings in inappropriate behavior, especially in social events and gathering. What is normal part of forgetfulness? You might forget names, numbers. People might have trouble balancing their checkbooks, so they try using calculators and other aids. Now, the symptoms and signs in people with dementia, the major signs and symptoms that bring patient to our offices, like to the geriatric office, usually memory impairment, still the #1 complaint by patients. Usually the memory impairment and the other cognitive impairment are gradual, and they tend to become more severe as time progresses. Also, there is behavior and mood changes. The #1 complaint I hear from family members is, my mother or my father is not behaving himself, is not acting like him or herself. And reason for that is the personality changes that is essential part of dementia. Dementia affects not only memory and behavior, but also affect people's ability to function in their daily routine, ability to cook, ability to balance the checkbook, ability to use the telephone, ability to use public transportations, really ability to remain independent in their own home. Again, when we talk about dementia, it's not only Alzheimer's disease, but there are other types of dementia, as we just mentioned. The second most common type of dementia after Alzheimer's disease is vascular dementia. It's still dementia, but in addition to that, there is symptoms and signs of small strokes that happen in the brain. For example, there is weakness, there is problem in speech, there is problem in swallowing, there is numbness, there is abnormal movement in some patients. So in addition to dementia, there is evidence to suggest that patient has had small strokes, and the evidence of those strokes are apparent in the weakness, numbness, speech, or swallowing functions. Okay? A lot of patients with depression, they might present in a similar fashion to what we see in people with dementia. This is why in the old days, it used to be called the pseudo-dementia or the false dementia. However, people with depression, usually, if you ask them specific memory questions, their answers are right, but their motivation to answer your questions or their motivation to participate in the conversation is lacking because of the depression. Okay? And they tend to express cognitive impairment more than what you are able to see on the exam. And these are the typical signs, symptoms, and signs of depression. People usually have sleep disturbance. They might have loss of interest in things that they used to do, like hobbies. They might have guilt feeling about either family members or themselves. They have lack of energy, lack of concentration. They might have change in appetite. It could be eating less or eating more. Either ways could be signs of depression. They might have suicidal ideations or thoughts, and also some psychomotor retardation. They are slower than usual. If you have somebody who's acutely hospitalized in the hospital, their confusion could be delirium. Delirium is an acute change in their mental status caused by an infection, medications, or the hospital stay itself. By definition, it is something acute that just happened today or only in the last couple of days. Dementia is a progressive illness that happens over a long period of time. And people with delirium, they have fluctuation throughout the day. So if I'm seeing the patient in the morning, patient might be very confused. In the mid-afternoon, their cognition or their alertness might be much better. Again, delirium is something acute that happens because of an acute illness, and this is different from dementia. However, patients with dementia are usually those who are at risk to have delirium more than others. Okay? Now, Alzheimer's disease is the main type of dementia. Let me talk about 2 or 3 different types of dementias that we still see. One of them is called Lewy body dementia. We start recognizing more and more in the recent years because of the advancement in neuroimaging studies. Lewy body dementia affect people the same as Alzheimer's disease, but the symptoms are different. They have 3 core features or 3 essential features. Number 1, in addition to their dementia, they have visual hallucinations. They are seeing specific images, usually are vivid and repetitive. A patient with Lewy body dementia might tell the family about seeing small children playing in the room, or might seeing birds singing, or might see certain animals, usually cats or dogs, playing in his or her bedroom. Those tend to be repetitive and vivid for the patient. So they have dementia, they have hallucinations, and they have abnormal movement similar to what we see in people with Parkinson's disease. Okay? In addition, there are supportive features. Example of that, they might have unexplained syncope or fluctuating level of consciousness. Also, they might have visual spatial hallucinations or abnormalities where they might bump into things in their way. Okay? So Lewy body dementia, again, we start identifying more and more of that. The third type, which is also common, is called frontal temporal dementia. What is unique about this type of dementia is the memory itself might be well preserved till more advanced stages. As the name states, it affects the frontal lobe. And because of that, personality and character is affected early on. So patients will have uninhibited type of behavior when they are behaving abnormally, inappropriately in social gathering. They might be saying specific statement that is inappropriate. Some of that might have sexual context into it. And the family really get embarrassed by the action and the behavior of their patient with the frontal temporal dementia. The other feature is it affects younger patients, those in their 50s and early 60s. Okay? And also they are a feature of frontal temporal dementia where language might be affected, and they are actually a certain type where people will become aphasic. Aphasia means inability to speak. So the language is affected and the behavior is affected, and it affects people at younger age, 50s and 60s, affects males more than females. So, men much more than women. And again, you see that the symptoms is really reflective of which area of the brain is involved with that specific dementia. Okay. Now, mixed dementia, what we mean by that? People could have Alzheimer's disease and Parkinson's disease, or they could have vascular dementia and Lewy body dementia, or Alzheimer's disease plus frontal temporal dementia. This is where the diagnosis of a specific type of dementia might be difficult, and this is where a geriatrician or a neurologist really needs to evaluate that patient to figure out which type of dementia patient is having. Okay? Again, this is just a PET scan of the brain showing that the brain scan that you see on the left is a normal PET scan. You see that the red and orange are really an active area of the brain, that area is very active. On the right side, this is a brain of somebody with Alzheimer's disease, where you see the activity is very diminished and very impaired. Okay? I'm sorry. There are newer technologies now where we could give a substance that it binds up to the area of the brain that is involved with Alzheimer's disease. It binds to beta amyloid protein, and you see that on the left. It's called the PIP or Pittsburgh compound, where different from PET scan. Where PET scan, you see decreased activity. In the Pittsburgh compound, you see increased activity because these are the area that the tracer is binding in the brain. So this is hopefully will have more applications in the future. One of the new research that is happening in the area of dementia is trying to identify biomarkers. Biomarkers is something that you could measure in a normal person or in a person with Alzheimer's disease that might tell you that this patient has Alzheimer's disease even before the symptoms start appearing. And that has a lot of implication in finding cure or preventive treatment for dementia. And actually at Beaumont, we are very actively involved in trying to find a biomarker for Alzheimer's disease. We call it the Biobank study. A lot of people ask me, could we prevent Alzheimer's disease from happening? I'm hoping that we will be able to in the future. It might not be possible at this time, but there's a lot of research, a lot of studies that are ongoing trying to identify what things could, if we implement, could prevent Alzheimer's disease. A lot of people talk about antioxidant. One of the theory of Alzheimer's disease is oxidative stress, or that the brain cells are dying because of hyperoxidations. We know that certain medications and certain substances, including some of the vitamins, have antioxidant properties, like vitamin E, for example, folic acid. Also, there's inflammatory reactions happen in the brain in people with dementia, including Alzheimer's disease. So if we are using anti-inflammatory medications, would we be able to halt the progression of the disease or prevent it or treat it? Then cholesterol metabolism is involved in dementia, including Alzheimer's type dementia. So if we are using medications to treat hypercholesterolemia, would that be enough to treat also Alzheimer's disease, or would that be an agent that could be considered to prevent Alzheimer's disease from happening? What we have proven so far in 2014 is if we are exercising on daily basis, both physical and mental exercises, we are able to delay the onset of Alzheimer's disease. And this has been well proven in several studies. Second, if we are decreasing the amount of fatty food that we are eating and red meat, and increasing the amount of vegetables, nuts, and fruits, and olive oil to some degree, like a Mediterranean diet. Also, there's some studies showing some decrease in late onset of Alzheimer's disease and delaying the age of onset. Use of statins, medication that we use to treat hypercholesterolemia, like simvastatin, lovastatin, and so forth. If people are using it at midlife, the incidence of Alzheimer's disease also might be delayed. But when they did that in large-scale studies, there is a trend for that, but it was not statistically significant. Okay? Higher level of education and higher level of social interactions has been shown to delay the onset of the symptoms. It might not delay Alzheimer's disease itself, but it will delay the presentation, clinical presentation of the illness. Taking omega-3 fatty acids, fish oil, in some studies have been shown to delay the onset of Alzheimer's disease, and even it might delay the progression of the illness. Okay? Being physically active and mentally active, it's still my #1 recommendations for everybody. Treating diabetes and treating hypertension really well in middle life, people 50s and the young elderly, 60s and 70s. Also, it might have an impact down the road in delaying or decreasing the incidence of Alzheimer's disease. Okay? Now, people with Alzheimer's disease are really desperate because really we don't have a cure of the illness at this time. We are working on that. If you remember, President Obama is challenging the scientific community to come up with a cure of dementia-specific Alzheimer's disease by the year 2025. Scientists are working day and night. There is billions and billions of dollars in funding for research to identify the underlying pathophysiology of Alzheimer's disease and why people develop Alzheimer's disease. Okay, so trying to really get to the root cause of dementia if we can. However, because people are desperate, family members are desperate, they really would like to have something that will help their loved ones. This is where fraud and scams come to play. This is a MDR Vital Factors. This is a vitamin supplement that actually it was shown on CBS and ABC over the last 10 years with the promise that it's going to bring our memory back to the way it was in their 20s and 30s. Okay? I will bet you that billions and billions of dollars are being spent and a lot of people are purchasing that. This is really similar to the sugar pill or any multivitamins that a person able to take from over the counter. Okay? In addition to using medications, trying to treat symptoms of Alzheimer's disease, education is very important. Educating both patient and family are really essential. If the caregiver is expecting what kind of symptoms or behavior the loved one might exhibit, they'll be able to anticipate that and hopefully be able to manage those symptoms. Okay? Example of the non-pharmacological intervention, cognitive enhancements. What are these? Are mental exercises, crossword puzzles. If a son or a daughter, go out to a restaurant or to a movie with a loved one with dementia, let's talk about what did they like about the restaurant. What did they like about the meal, about the environment, about the waitress? Or if they go out and see a movie, let's criticize it. Let's try to stimulate them to think. The more we use our brain cells, the longer we'll keep our brain cells. Okay? Trying to have irregular appointments, trying to organize their daily routine so there will be less chance of patients with dementia being confused. Okay? Trying to stick to a daily routine, break tasks into small segments so a patient will be able to perform that and they will be able to get enjoyment and positive feedback from being successful in doing these small tasks. In addition, we need to be really respectful to patients with Alzheimer's disease. If you are a family member, you need to make them feel safe, secured, and respected. This is really important. Try to avoid large, noisy gathering because they tend to get more confused in this kind of setting. There is a phenomenon called sundowning, as we see it in people with dementia. When in the evening and at night they tend to become more confused because of lack of the daily, daylight and the sun exposure. So to treat that is really trying to provide orientation clues, trying to keep them in a well-lit area of the house during the day, and be sure that they have a rituals or routine when it's time for bedtime, and try to avoid giving teas, coffee, or any stimulants in the afternoon or evening. In addition, I do encourage family to seek the help of like an attorney for will preparation, conservatorship, estate planning. Also, there's a lot of resources available in the community, such as the Alzheimer's Association, speech and language program at Beaumont Geriatric Center, area agency on aging, and Meals on Wheels, and so forth. Okay. Thank you. Again, this is Dr. Khaled Imam from Beaumont Hospital. Just presented to you Understanding Dementia. I hope this was helpful to your audience. Thank you.